Welcome to the Keeping Mums Fit workshop, where we'll explore how to safely approach pre- and postnatal fitness. Before we get stuck in, just a bit of housekeeping. Please stay muted throughout the discussion and select speaker view unless, actually that's probably not relevant, as you can probably just see the presentation, which is great. So add questions to the chat box throughout, as we will be doing Q&A later. This workshop will run for about 30 to 40 minutes and it is being recorded. So as usual, if there are any issues with that at all, just let me know. I want to welcome today's guests. We have our beautiful Christina and Stephanie, who are women's health physios from Lively Physio. And can everybody see them? Hopefully, possibly. They just did give a wave. So thanks for joining us today, ladies. Really excited to have you here. Today's session is going to run a bit like this. So we're going to do a values exercise where I'm going to ask what kind of mum do you want to be? And then we're going to go into how to approach prenatal fitness and then moving on to postnatal exercise. Keeping in mind this is a fairly generic presentation. Given it's only 30 to 40 minutes, we'll only be doing a pretty big outline instead of going into the details. And then we'll get into why every mum needs to see a women's health physio. So our beautiful physios are going to do a bit about what to expect with the pelvic floor examination and also a bit about abdominal separation, otherwise known as diastasis recti. So then we'll go to Q&A with myself and Christina and Stephanie. So who am I? I am Julie Freeman. If you don't know me, I think everybody here has met me enough now to know my name, but I am a pre- and postnatal fitness coach. I am Safe Return to Exercise accredited with Body Beyond Baby, which is run by Jen Dugard, and that's I did my PT last year. I am passionate about maternal health, especially after having my own son in late 2019. I created the space Social Nature New Mums Collective somewhat in response to COVID-19, but largely it's been something that's been brewing for quite a while now, as it's really a passion of mine to provide support to new and expecting mums to navigate this time and the vulnerable time that inevitably comes with motherhood. I really, really am excited to empower mums to thrive in pregnancy and beyond. I do want to give a disclaimer. It is essential that you do consult a doctor or a medical professional prior to starting any exercise program. Explain the nature of the training you hope to do and work with them closely to monitor how you feel during exercise and make sure it's the best thing for you. And always contact them at any time at all if you have any concerns. So I'd love to know, where are you at in your journey? Are you pregnant? How many weeks? And postpartum, how many weeks? I have a vague idea of a couple of you. And how are you feeling about your fitness right now? Are you ready to get stuck in? Have you got stuck in? And I'd love to hear from you. So today's mission is to help build confidence to train safely during the perinatal period, which is pregnancy, postpartum and beyond. My approach is that I dislike the terms bouncing back. Essentially, you'll find out why in the coming slides, but let me give you a sneak peek. It's about reinvention rather than bouncing back. So let's get stuck in. What are your 3 key values? The reason I approach it like this is because it's all well and good to, talk about fitness, but it's important to think about why. And then I think once we think about why, we can really stick with it. And it's something that we want to keep coming back to again and again. Excellent. Thanks for the letting me know where you're at with your postpartum journey, Danielle, as well. I'll keep that in mind. So values are what we believe to be important in the way we live. So if what we value and how we behave are in alignment, basically we're going to be cooking with gas, keeping in mind that we are mothers with many competing priorities. So I could spend an entire workshop on this one, but I just want to take a moment to think about this question in the context of the question of what kind of mother do you want to be? My psychologist posed this question to me, and it's really kept me on track with a lot of things in my life. And so I'd love if you could write your answers down. Think about 3 key values. Don't overthink it. Just what are the top 3 things that come to mind? Some examples might be adventure or boldness or calm or caring or compassion or contribution, maybe family or humility, love, resilience, even well-being. So some of my three key things that guide me are family, for example, connection and compassion. And I really do like well-being. If I'm not feeling good, I don't feel good. So yeah, please write your answers down, and please come back to this if you would like to, because it's a great exercise to come back to. Thinking through your values and the mother you want to be will help shape the actions you take in your life. For example, if you value well-being, then you can set goals and make decisions with greater clarity. Keeping in mind, you might have a bit of sleep deprivation fog as well, so that's okay too. Being clear on what you value will presumably mean that you're more likely to carve out that time necessary for yourself when it comes to exercise or eating healthily, because maybe you want to be a really good example to your kids. I'm sure you do if you're here. So yes, why exercise in pregnancy and beyond anyway? So for the most part, we actually shy away from exercise in pregnancy and the early postpartum period. Sometimes we're guided to do so by well-meaning people, or we have a genuine reason not to. But for the most part, exercising is safe. And in fact, it is highly recommended for pregnant and postpartum women, just with a bit of a facelift. So some of the things, the recommendations are that pregnant women accumulate at least 150 minutes per week of exercise. That's approximately 20 minutes daily. And that's not a huge deal, is it? And we just want to keep an active lifestyle. What are the benefits of exercising in pregnancy anyway? So some of the benefits that have been shown, and this is hard to study, but shorter labour is potentially a benefit, better recovery postpartum, lessened degree and severity of abdominal separation, reduced back pain, and look after baby's health as well as mum's health. The Australian Physical Activity and Sedentary Behaviour Guidelines recommend, as I said, that pregnant women try to do some physical activity each day, moderate intensity, and if there are no contraindications, it's highly recommended to do regular aerobic and strength conditioning exercise during pregnancy. This is hard to study, but there's no evidence as such to suggest that regular exercise during an uncomplicated pregnancy is detrimental to the woman or fetus. So, we shy away from exercise potentially because we're afraid of doing damage to ourselves or to our babies, but what we're seeing is that there's actually more reason to do it than not, and the benefits far outweigh the costs of not doing it. Some of the considerations you want to think about are the frequency, intensity, duration, and mode of exercise. So what are my tips for prenatal exercise? First of all, modify exercises and listen to your body. Your exercise program must support your pregnancy and no one else's. Notice how your body is working during the exercise. Your body is coursing with relaxin and other things that are really, putting pressure down in the pelvic floor and other things like that. But how does it feel for you? If you want to think about general recommendations, some of the things might include like not lying supine on your back after the second trimester, but what you really want to think about is how does it feel for you? Also, if you have any diastasis recti, which is basically the abdominal separation, you might want to consider how to modify, and our women's health physios will probably go into that a bit more later. You want to be cautious of impact work and other things like that. Think about exercise in general. If you have any issues at all, such as bleeding or pain or anything like that, dizziness, headache, chest pain, there are good reasons to discontinue or to reassess what's happening. But generally speaking, if you don't have any of those really big contraindications, it's just about modifying and listening to your body. So the second thing is building a strong foundation and strengthening from the inside out. So with pregnancy, obviously, there's a lot of different alignment issues happening, and we want to keep in mind of how to keep strength and build a healthy pelvic floor and keep an eye out for that abdominal separation. So the last point is manage your expectations. While being cautious of impact work or body discomfort and fatigue, and then modifying your exercises, it's probably likely, especially towards the end of pregnancy, that you're not going to be exercising to the same level as before. And that's a huge thing. That's really tough. It sucks, actually, especially if you're someone who really loves exercising and it's a huge benefit for you. So I really highly recommend that we think about how to manage our expectations of exercise. So next we have postnatal exercise. So what are the benefits of this? There are so many. With proper nutrition, hydration, and activity, this may save you from the craziness of newborn and new mother life. Some of the things that are great about postnatal exercise include such things as increasing core strength, reducing pain, looking after baby's health as well as mum's health, which really, is great for bonding as well. Mental health is huge, postpartum recovery and self-care as well. And I failed to mention, that if you are exercising in pregnancy, it's also more than likely that you'll be able to return more safely to exercise postpartum. So there are some challenges which sort of come across both pregnancy and postpartum that we need to think about, such things as exercise history. What has the mum been doing prior to giving birth, and how is her body feeling now? Other things include body changes. So how has your body responded to pregnancy? How is your pelvic floor feeling, and are you breastfeeding? These such things, often I think we sort of give blanket advice to postpartum women when it's really individual. And then we have birth and recovery. There are difficult experiences out there, and some complications can come about from birth. So we want to consider how it went, if the GP or women's health physio has provided clearance to return to exercise. And then lastly, how we can do it slow and steady. So I think a lot of us, we just want to jump back in, but we really want to be conscious about checking in with our own body and not smashing it immediately, which I will talk a bit more about in 1 second. So my 3 tips for postnatal exercise. First of all, take it slow and honor your body and your journey. When ready, exercise must support your postpartum experience, birth, recovery, pelvic floor, mental health, and your experience of having a baby as well. So follow the people who lift you up rather than drag you down, and with blanket advice about bouncing back. Basically, I give you permission to unfollow anyone that stirs that comparison thief within. We are all in this together, yes, but we're also very different, and every pregnancy is different. Every birth and postnatal period is different. So take the time to listen to your body and honor your journey. And I highly recommend seeking support too. The next, again, like pregnancy, is to build a strong foundation and strengthen from the inside out. The same here is quality over quantity is vital. We don't need fancy, we need strong. What we want to do is add layers and stages gradually and build a strong foundation for life. It's not likely you'll be able to move in the same way as you did pre-pregnancy straight away, it is going to take time, but the more you focus on building a strong foundation, the longer you will actually keep fit, and the safer you are, slower the longer you can exercise, and the better it will be for you. So we want to focus on basic movements done well. Less is more initially. Another thing is we want to think beyond the 6-week checkup. So for a lot of us, the 6-week checkup isn't enough. Rebuilding strength takes time. Remember, it did take 9 months to grow a baby, and that takes a toll on the body, and it's going to take time to build that strong foundation. We need to work closely with both a doctor and a women's health physio to assess things down there and to work on rehab postnatally. A lot of things will affect that return to exercise, but as soon as possible, generally light exercise is encouraged to begin with. So I think there's two sides of this, right? So it could be harmful to say, 6 weeks, so then we don't exercise for 6 weeks, or then we think, okay, 6 weeks, now we can get into it straight away. Basically, we want to go low and we want to go slow. Okay, so in summary, here's what we want to think about. Come back to your why. As always, what kind of mum do you want to be and what values do you want to live by? This will help sort of, manage those expectations and to start from the bottom up. Lead by example. Then we want to manage expectations and think about what the body has done and what it can do now. Your body has changed, and that's a really hard thing, and there's probably some grief to go along with that, but your body did also create life. And then we want to focus on basic movements first, support the healing process. We don't need to be fancy straight away. And then understand your body, honor and honor your unique experience and listen to your body's needs and respect those too. Then build from the inside out, because you could be stronger than you've ever been if you do so. And then go slow and have patience. It isn't too late to start, but make sure that the exercise you're doing supports your body and your individual healing process, and get support as well, which is why I am about to pass over to our lovely women's health physios to talk us through. So a couple of stats which are quite big, and some that I did mention in our last pelvic floor talk. So 1 out of 3 women will experience incontinence after having a baby, and 1 out of 2, and possibly even more, women will experience prolapse after having a baby as well. And we just don't know 100% what a normal mobility of the organs are in a woman yet, but basically that's pretty high, isn't it? And research has shown that specially designed pelvic floor muscle training is effective in the prevention and treatment of these conditions, which is huge. Oops, sorry. Giving you too much of a look into what we're going to talk about. and these can treat stress, urinary incontinence, and the benefits of these exercises are still present at least 1 year after delivery. So that's huge. So basically, I'm going to pass over to our women's health physios to talk you through basically why you should see them and what happens. Christina.
Hello. Hey. Hi. I'm Christina, and this is my colleague Stephanie. We both are women's health physios working at Lively Physiotherapy and Pilates in Tarahumara, northern part of Sydney. And we're just here to talk about what you can expect and all the different things that we can do to help and to support you in your pre and postnatal journey. So a lot of the times we get, what happens when you come to see us and what can we offer? It can be really, really scary to, watch your body change. It can also be exciting. And we just want you to know that there's so many things that you can learn and can do to help support that body going forward. And it's about As Julie's mentioned, managing expectations, but then also remaining positive and learning about some of those strategies and things that you can do instead of, grieving the loss of the body you maybe had before. It's about supporting you going forward. If you come to see us, what would happen is us, and we basically have a chat initially. We talk about what you're experiencing in your body, what your body was pre-pregnancy, where you are at, where you are now. Do you have any symptoms? Are you experiencing some of that incontinence or some of that pressure or bulging that signifies a potential prolapse? Or are you experiencing some pain with intercourse or some dryness or some, itchiness? All those are, valid concerns, and we would talk through those and find out what you are experiencing. We would also talk to you about your goals at this stage. What did you do beforehand and what would you like to get back to? And it's having those goals in mind the whole time that allows us to help create a plan and support you, going forward. After that, we would do a bit of a posture, an alignment screening. That plays a key role in our everyday life as well as in exercise. We would have a look at, where you're at and, what you could do to maybe improve. And then after that, the main examination is a vaginal examination. Okay, so what that means is that you're lying down on the bed. I've got my handy pelvis here if you can see it. Okay, so if you're lying down here, this would be your head, okay? And this is your bottom, okay? And this is your pubic bone. So this is the top, okay, the front. What you would do is we would first look, and we're just getting a general observation of what's happening, okay? What the superficial muscles look like. Is there any redness, signs of infection? Is there any tissue changes to be aware of, okay? And then we'd also get you to do a pelvic floor contraction. And visually, what we would like to see is we'd like to see a drawing in, okay, of the area between your vaginal opening and your anus or anal opening. We'd like to see a drawing in there and a gentle squeeze there. And that's what a pelvic floor contraction would look like visually, okay? But we'll go a little bit deeper, and then as long as it's comfortable, we will gently insert 1 or 2 gloved fingers into the vagina, okay? It's done very slowly and gently. At any point, if you're uncomfortable, we can stop the examination. And then what we're gonna do is we're gonna end up on those deep layers of the pelvic floor, okay? So the layers that live deeper within our pelvis, okay? And those are really important for that lift and for that support of the pelvic organs, okay? So it's not enough to just have a lift or to just have a squeeze. We'd like ideally to see some combination of both. So we're assessing the whole pelvis and all the muscles and how they interact with each other, all right? In addition to assessing the muscle function, okay, and your pelvic floor contraction and whether you're doing it with both of those components well and coordinated with your breathing, or whether we need to adjust a few things, we will also assess for that descent of those organs, okay? That's usually done with, we'll insert a little popsicle stick, basically, okay? Put a little pressure down on the back of the vagina or up on the back of the vagina, and we'll get you to have a gentle push, kind of like you're going to the bathroom and doing a number 2. And as you do that, we'll look to see if any of those organs start to move or descend, okay? And as Julie said, there's the research on what is normal laxity after birth, and at what point after birth is normal is still unknown. We're still doing that research, and everybody's body is different. Everybody will have different presentations and symptoms. We do have a bit of a grading system, and so we can give you some idea of where those organs are at, but even that can even change within 24 hours. So not only can it change within a week or a month, okay, but it can even change the time of day. If you come first thing in the morning, you're going to get potentially a different result than if you're coming at the end of the day after you've carried your baby all day and walked around and done the housework and been on your feet all day, okay? It's a system that's constantly changing, okay? So, you know, a lot of women, you know, as you mentioned, Danielle, at the 10-week mark, they kind of go, okay, this is what my diagnosis is, but it not only can it improve, but it can also change, you know, a lot. Okay, you're going to have days where it's better and days when it's worse. And so it's about managing that and learning on what you can do to help it going forward. All right, so that's kind of a very basic assessment, okay? If you're experiencing pain, we're going to be looking for tenderness and specific trigger points that we might need to release in the muscles there. Just like a muscle in your arm or your leg, okay, there's going to be areas that might benefit from a little bit of work done on them, okay? But we'll walk you through that and explain things as we go, okay? So that you feel comfortable and supported in that environment. All right, is there any questions? Great question, Danielle. So she asked if it was therefore better to come in the morning for an assessment, okay, or in the afternoon. For your initial assessment, it's probably better to come when your symptoms are probably more at their worst, so probably later in the day, okay? But if that doesn't suit, then a morning assessment would be absolutely fine, okay? What I tend to do is if I'm seeing someone, I'll get them, and you know their symptoms aren't necessarily matching with what I'm seeing, is I'll get them to come at different times in their follow-up appointment. So I'll say, okay, look, I saw you first thing in the morning this time. Next time, can you go for that walk in the afternoon and then come and see me? Is that a possibility? And if that works with their schedule, then we get a bit of a more thorough picture that way. But we're also aware that the tissues are going to change. They're not going to change significantly. You're not going to change from a stage 1 to a stage 3, okay? But there is going to be some variation in that. So I would recommend initially, if you wanted your symptoms to be the most obvious, then to come when they feel at their worst, and then we can progressively work from there. Did anybody else have any questions regarding the exam? Great. All right, there'll be more time for questions at the end. The main exam that we usually, this is what we would do at our 6-week checkup. So once you've seen your midwife or your obstetrician, you will, and you've stopped bleeding, although that's not a contraindication for the exam, that's just more for comfort and to make sure that you've had that clearance through your medical professional. We usually do this assessment after the 6-week mark. So 12 weeks would be fine. 6 weeks is probably the earliest we recommend you would come in, and any time in between there is also acceptable. So, but you do want to get an assessment fairly early so that you can get that knowledge and you can put some support systems in place before you maybe return to some more intense exercise or movement patterns. Okay. Another thing that we go through in our exam, that was the pelvic floor aspect, but we're also going to look at your abdomen, okay, and that abdominal muscle and that abdominal separation that is so common. I'm going to let my colleague Stephanie here go through that with you. Okay.
Hey guys. Perfect. So basically, just looking at diastasis recti. So the first thing to note is that if like 100% of people at 35 weeks when they're pregnant are going to get this. And what it is it's the separation of the abdominal wall. So if you think of your 6-pack, it's the line down the middle, and that's made up, it's what we call the linea alba, and it's made up of connective tissue. And so what happens is that stretches to allow room for the baby to grow. So it's a perfectly normal thing during pregnancy. In terms of recovery, you'll see on the slide, the highest degree of closure occurs in the first 8 weeks. And that, a lot of that will naturally happen, but there are things we can do to help along the line. And without any intervention, no further closure occurs from what the research has found after 1 year. So it's really important to get intervention and actually go through an exercise program, and also having a look at things like alignment and posture can make a difference as well. And that's where we can further assess and treat you when you come and see a women's health physiotherapist. And the really important thing is that when it comes to an abdominal separation, it's not actually important in terms of how wide it is. So some people might never completely go back to what they had before. And that's actually okay. It's about how you apply tension to that connective tissue. Because forces, when we do different movements, our muscles interact with each other, and forces have to be able to pass from one muscle to another muscle. And that happens across this linear alba. And so if you're not generating good tension through it, that's where it becomes more of an issue. And so if you're wanting to do things such as powerlifting or running and those sorts of activities, or even if you're just wanting to lift a toddler, it's important that you can generate that good tension. And so that's what we're going to go through and give a bit of a demonstration of. I'll show you what doming is as well. So doming is where you don't generate that tension, and because of that, it actually domes. And so we'll try and demonstrate that. I think that's, yeah, perfect. Okay.
So for those of you, I am 32 weeks pregnant with my second. Okay, so as she mentioned, all of us get some degree of separation while we're pregnant. Okay, I'm going to show you what that doming looks like, because it is that common thing that you can get during pregnancy as well as postnatally. Okay.
So,
or if I do here.
whatever position you reckon is the best to demonstrate.
Okay. So.
Okay. So what we're looking at is, you can see here, you can see the doming happening there. And that's just because the weight of, well, in this case, the weight of the baby is actually just putting pressure, and there's not enough tension generated to actually, through the linear alba, to hold that. Did you guys see that?
Can you guys see that? I don't know if you can see it.
Just.
Do you see that triangular shape?
I did. Did everybody else?
It kind of goes like this. It looks like a Toblerone.
Toblerone.
Okay, so it will go out like this. Okay, instead of being drawn in like that. Okay, so I would not be at the stage where I'm doing push-ups down here, because I cannot maintain that. So if I did want to do push-ups at this stage, I would be up higher, either in a much higher incline, or I'd even be on the wall. And then I would do my push-ups that way, because then I can support without getting that doming sensation.
Perfect. And then after, so that's obviously during pregnancy, but after you've actually had the baby, obviously you no longer have the baby in your stomach, but you still have that, you'll still have a reduction in tension development. And so then what we do in a women's health assessment is we have a look at how well you can apply tension, and then we'll give you some exercises to help work on that. So for example, when we start to assess you, we'll actually just get you to lift up your head like that. And we'll see how much tension you can apply across, and also be able to have a look at the gap that is created between the muscle bellies of the rectus abdominis. So we'll be able to tell how much is there in terms of gap, and also how much tension can be applied. And from there, we'll then go through A, how to actually develop tension, and B, how to then strengthen your abdominals, and then how to actually then progress that, you know, along the journey to then eventually be able to do things like running and powerlifting, whatever other task is relevant to you. Yeah.
Yeah, as you can see, there's a lot of information that you can gain from that initial session, okay? And we can, you know, with your goals in mind, we can develop a plan and say, look, okay, you know, this is what your goal is. That's fantastic. How can we help get you there? Okay, and it's just about putting in place those steps, okay, so that you get a, you know, quicker but also safe return to activity, okay? Because if you don't, the potential is that you could start to use non-optimal movement patterns. And if you start to use non-optimal movement patterns and they become a big habit and you use them again and again and again, then you can potentially be putting more pressure in areas that you don't want. So more pressure on your pelvic floor or more pressure into that separation. And then you're actually slowing the recovery or potentially making it a little bit worse over time, okay? It's not going to get worse, you know, with one movement here, one movement there. It's more of a, you know, building the blocks and the habits that you're going to have going forward. And you want to just make sure that you're moving in a way that's helping your body get back to where you'd like it to be and not making it detrimental. Okay. For all you ladies that are here and that find this video later, as part of a promotion for Social Nature, we are offering a 10% off voucher for your first initial consultation if you're in the Sydney area near Stephanie and I. And you can find those details on the next slide, okay? We've got, when Julie puts up the presentation again, we've got our contact details, how you can find us, our phone number, our email address, our website. And if you just mention this group or even send us a message, we can send you that voucher, or we can make a note in the system that you found us through this wonderful group that Julie has created.
Thank you. So can everybody see the slide now? I think so. Can you guys? Yeah, so we've got the phone, fax, and email address and the website. So that's an incredible offer. So thank you so much, ladies.
That's all right, our pleasure. Anything to help the moms get back to activity.
Absolutely. Absolutely. So now we have time for question and answers if you have any at all. I've got a few from the group as well that we can go through, but are there any questions about anything that we've discussed so far? I might just start with the first one. So we've got Anne who says, I've been doing YouTube prenatal stuff, but it's hard to stay motivated when I feel so tired. How do you keep motivation? Can I do 10-minute sessions, or is 20 minutes really the ideal? So that really comes from the 150-minute recommendation, doesn't it? So first I want to think about why you're doing it in the first place. Are the YouTube videos going to cut the mustard? So I would think less about timings and more about what exercise you'll do consistently, even when you're tired. Motivation doesn't exist in the way that we think about, so action must come first. Keeping in mind that growing a baby is really hard work, and you really want to just do what you can. It's usually better to schedule an exercise, and as I said, just do what you can. Another question is about lay meals. So we have Elise who says, I was doing lay meal postnatal exercise, but haven't done any since moving a month ago. So she has been walking 2 to 3 Ks every day, but she's interested to know the best way to keep something up like pump. And she doesn't want to dive in and do herself any damage. And feel free to come in here at any time, Christina and Steph. But basically what my thoughts were is lay meals tailored to you enough? Like what I've seen looks okay, but I'm not sure if there are modifications available or if you have access to somebody who can help you through doing that. I would be asking like why you stopped the exercise, and if you're worried about doing yourself damage, then the first person I would see is a women's health physio, and I highly recommend the ones we have here, obviously, or a PT who can work in to complement any recommendations that the women's health physio provides. And the third question I have here is from Kate, who asks, she's been walking and she does have stomach separation physio exercises, but she's interested in knowing what is safe to do and when. So she loves barre, running and yoga. I will pass this one to Steph and Christina. Would you like to answer that one?
Sure. What I would start by saying is I no longer give people, you know, a blanket, no, you cannot do these exercises. You know, everybody cannot do these exercises. It's so individual and it's so dependent on the person's body and what their muscles are doing and how they're working together. So instead, I would assess, you know, certain components of what that person would like to do. So whether it be the bar class, the running, the lifting, and I would just see what is their strategy and are their muscles doing, you know, what they need to do to support them in that position.
Yeah, definitely. I think in terms of things like running, for example, there were some running guidelines that were released, I think, late 2018. And they sort of basically go through a bit of a plan as to when you can actually get back into running, or what's at least recommended as a general rule. And they say like not to go back earlier than 3 months. And that's just because the pelvic floor and the soft tissue is all still healing and actually takes longer than what you think. And so you want to make sure that you've had time to actually go through, you know, like things like working on your deep muscle activation of your core and working on pelvic floor strength, so that when you run, you're not going to get as many symptoms, or hopefully any symptoms, and you're actually going to be able to progress safely. And it also gives you time to work on things like strength, so that you are less likely to build, you know, or get any other injuries as well. So from 3 months, they sort of say to gradually start building up, but to take your time and to work into that as your body sort of feels able. And listen to symptoms and pay attention. And that's something that we'll often do is work with you. And if any symptoms pop up, then we try and develop a plan and exercises that are very tailored towards you. But yeah, I absolutely agree with Christina in terms of you've got to do what you love when it comes to exercise. And exercise is so important for your well-being and for your general health. You've got to find something that you love. And so I wouldn't say no to someone doing anything they want to do. I'd be wanting to look at, okay, how can we get there and what are the challenges before us and how can we work around them to get you doing what you want to do?
I really like that response, and I really would mirror that, absolutely. Some of the things I wanted to think about were, you know, in context of your body, how does it feel? And I want to encourage people to exercise. I don't want to discourage them. So I really love that. How to return to exercise really depends, doesn't it?
It does, but it's about finding that support.
Yes.
Whether it be a certified trainer like yourself, or a women's health physio, or a combination. It's about finding that support and using some strategies. We have a lot of screening tools and advice that we can, give to you. And so it's about finding that support network that's going to help guide you down the path that you'd like to take.
Beautiful. So in summary for today, here are the 3 ways that we want to approach pre and postnatal fitness and exercise. So first of all, there's no one size fits all approach. I say screw bouncing back and screw all the advice that is too generic out there, because it's about what your body has done and what it can do now. There are new challenges to motherhood where it is tough, and we want to find your style. Secondly, honor your body, which sort of ties in the first thing. So your body and life may not be the same, but I want to normalize that rather than, tell you to rush back, getting your life or body back. let's reinvent instead. Because you could be the strongest you've ever been, but you want to start slow and low and steady. And then lastly, as Christina just said, get support. Don't do it alone. There's absolutely no shame in asking for support from the right people. In fact, the fact that you're here makes me super proud and really excited for your journey as well, because it sounds like you're going to go on the right journey. As Danielle's just said, slow and steady wins the race, return to fitness race. Absolutely. Yeah, no, I don't want to discourage you either. So as I was, this is the last thing I want to say. Fall in love with taking care of your health and honoring your individual journey. Your body is the site of the miracle of life after all. The most important thing we can do for our kids is to take care of our fitness and our health, and to stop putting ourselves last, because we actually need our health to look after our family. So in that way, we're actually putting our family first by looking after our health and fitness too. So thank you so much for being here today, and to our beautiful physios, Christina and Steph, for giving us such an amazing demonstration and talking us through what to expect. I'm so glad you're all here and really excited we could do this. So here's a few links. As before, there's 10% discount, which is amazing for Social Nature members to see Lively Physio in person in Sydney area. And there's some other links there you might want to follow. I can send those through as well. But I'd love to see a thumbs up or a yay if you enjoyed today. And thank you very much. Thanks, Danielle. We're so glad that you could come here and enjoy today. Yeah, so that's about it. I think we'll leave it there. We did hopefully not take too much of your time today, but I hope you really got something out of it. And if you have any questions or anything you need support with, I know that Christina and Steph are here, and so am I. So just shoot me a message. There's been a lot of information, so feel free to pop us a message. I do have lots of other, more specific guidelines about pregnancy and postpartum. And yeah, reach out if you need it. And thanks, Steph and Christina and Chaya and Danielle today for being here.
Our pleasure. Thank you.
We'll leave it there. Thanks, guys.